Welcome to Friday's edition of COVID-19. I'm Min San-hee. Korea's containment efforts are facing a new test as the daily tally hovers above 300 for the third straight day. We start the program now, as always, with our Kwon-soa with the latest on the pandemic here and elsewhere around the world. So we are ending this work week on a rather grave note with a further rise in daily cases here in the country.
Yes, indeed. Korea is dealing with rising infections day by day, calling for more vigilance, especially ahead of the weekend. 363 infections were recorded on Friday, which is 20 more than the day before and also the highest figure we're seeing in 84 days. And a grim milestone has been set here in Korea as the country has surpassed 30,000 total cases, which have been accumulated during 305 days since the first outbreak here in the country on January 20th. And also the number of fatalities has exceeded 500 now. And the concern is that there are more and more people now in severe to critical situation, with 84 patients in such a condition. We also have now more than 3,250 people which are currently in treatment or under quarantine. Now, this entire week, cases have been going up, as you can see. Now, last Friday, we headed into the weekend with almost 200 cases, and since then, they have been above 200 for the 7th consecutive day. And if we break it down to domestic and imported cases, we do see that also imported cases have been growing in recent days, but they are seeing a decline in past days, while domestic transmissions are really steadily going up here.
Right, so meanwhile, the Prime Minister earlier this morning had a few words to share to say that is to members of the public here.
Right, Sunny. It was the 6th such message made by Prime Minister Chung Se-kyun since the outbreak here in Korea, during which he warned that Korea's containment efforts are facing hurdles due to the recent cluster infections breaking out across the nation. So let's take a listen at some of the requests he made to the nation's people.
Please refrain from holding year-end gatherings and do not leave your homes unless it's absolutely necessary. People aged 60 and above should take particular care of their health in the winter season and avoid unnecessary outings. We also ask companies to delay or cancel year-end get-togethers and after-work outings while encourage remote working.
Chung also mentioned the rising proportion of younger patients as well as silent spreaders, which do play a role in the recent increases here in the nation. And health authorities are now publicly mentioning that the current situation appears to be the third serious wave of the pandemic here in Korea. Now, if we take a look at our map now, we see a lot of regions in red, which means many more places with cases above the double digits. And while level 1.5 social distancing measures are in effect in places, especially in the capital region, there might be a raise to level 2 even before the 2-week earlier set period for level 1.5 comes to an end, because we are seeing much higher figures than we have been hoping for, with 132 in the capital, Seoul, reported this Friday, followed by 73 in Gyeonggi-do province and also 30 in Incheon. So this region alone has more than 200 infections now. And now let's take a look at the figures abroad, which are also really not looking good here. 670,000 cases were reported in just a day. Accordingly, the number of fatalities are also growing day by day, with over 10,800 reported. Let's go over to the places severely hit by the pandemic. The U.S. has surpassed 12 million cases, 9 million in India, and also Russia has surpassed the 2 million mark. Let's take a closer look at the daily increases. The U.S. here with over 196,000 cases, almost 200,000 cases in just a day, and also serious surges in Italy with 36,000 infections. We will connect to someone in Italy later on to take a closer look at the situation there. Germany, Poland, some of the European countries also dealing with serious resurgences with 23,000 23,000 cases. And Japan is also now facing a third wave of the coronavirus with over 2,000 cases reported on a daily basis recently. And those are the updates I have for now. Have a safe weekend, and I'll be back with more updates on Monday. Back to you, Sunny.
Right, so thank you for that for now. Right, in this next corner, we bring you a recap of some of the COVID-19 headlines this week. I have our Kim Sung-hyun here in the studio with me for that. Welcome, Sung-hyun.
Good afternoon, Sunny.
Let's begin with some positive news then, Sung-hyun. Pfizer disclosed its final test trial results on Wednesday. Tell us more.
That's correct, Sunny. We are talking about an incredible milestone for science and mankind, really. Pfizer saying Wednesday that a final analysis of its phase 3 trial of the vaccine shows it is 95% effective in preventing infections, even in older adults, and it caused no serious safety concerns. Now, German company BioNTech and its partner drug giant Pfizer said that they plan to apply for emergency use authorization from the U.S. FDA on Friday, the 20th U.S. time. So for us, that will be any time between this afternoon until tomorrow morning. BioNTech CEO Uğur Şahin expects the vaccine's approval process to be completed and distribution to begin before the end of this year.
If everything goes well, we could start to supply the vaccines to Europe and the United States in the second half of December.
Now, Şahin added that their goal is to supply several hundred million doses in the first 4 to 5 months of 2021, which he says will be crucial in stemming the tide of the pandemic. He expressed optimism that if everything goes to plan and if they have a very organized vaccine supply chain, our lives could return to normal towards the middle of next year.
I'll keep my fingers crossed for that. And staying with that optimism, I hear new research suggests COVID-19 survivors may have a powerful, long-lasting immune response.
Right. Many people have been wondering about the duration of COVID-19 antibodies and the degree of protection that they can offer. Now, according to a new study, the answer to that question is immune protection is potent and they can last for years or even decades. Now, early research is showing that 8 months after being infected by the coronavirus, most COVID-19 survivors still retained enough immune cells to fend off the virus. So the slow rate of decay in their immune response over the short term suggests that these cells may be present in the body for quite a long time. Now, the research published online has not been peer-reviewed nor published in a scientific journal as of yet, but it is the most comprehensive and wide-ranging study analyzing multiple compartments of immune memory over time. The study included 185 adults ages 19 to 81 in the U.S. who had recovered from COVID-19. The researchers, including those from the La Jolla Institute for Immunology, analyzed blood samples collected at various points following the onset of symptoms, with some collected more than 6 months later. The findings are likely to come as a relief to experts who had suspected that immunity might be short-lived and that vaccines might have to be administered repeatedly to keep the pandemic under control, so certainly a sign of relief there.
Right, Sung-hyun. Well, that is good to hear, of course. Now, meanwhile, neighboring Japan, as Soa mentioned earlier, is struggling to fight hundreds of cases on a daily basis.
Right. Japan's coronavirus cases have been rising sharply, Sunny, logging a daily record of over 2,000, with experts saying that it could signal the start of a third wave in the country. Japanese Prime Minister Yoshihide Suga says Japan is on maximum alert a day after the number topped more than 2,200 infections in a single day for the first time on Wednesday. Suga told reporters that he wants people to wear face masks when conversing, even during meals, citing expert opinions. Now, Tokyo and Hokkaido notably have been seeing a worrying spike in their figures as well, putting a strain on the healthcare system. The Hokkaido prefectural government is calling on residents in its capital city of Sapporo to refrain from going out unless it's absolutely necessary.
For residents of Sapporo, I'd like to ask that you refrain from all non-essential outings, where it is difficult to avoid the risk of infection.
Now, following back-to-back days of record coronavirus transmissions, experts are calling on Japanese officials to heighten their preventive measures.
Also here in Korea, authorities are dealing with alarming rises in cases, of course, in recent days, with 1.5 social distancing in effect as of Thursday.
That's correct. The country enforced those tightened measures as of yesterday to help fight a resurgence of particularly small-scale clusters of infections. The social distancing level has been raised by 1 notch to level 1.5 in the greater capital area, including Seoul and the surrounding Gyeonggi-do province, and also the city of Gwangju and some parts of Gangwon-do province as well. Now, in the meantime, the city of Suncheon in Jeollanam-do province announcing it will raise distancing guidelines to level 2 starting today, the first jurisdiction to do so since the 5-tier distancing measures were introduced. Level 2 measures ban gatherings at 5 types of entertainment establishments, including singing rooms, and limits the operating hours for restaurants and cafes to 9 p.m. As for level 1.5, high-risk public use facilities such as restaurants and movie theaters, they will operate under several restrictions. Also, no more than 100 people may attend rallies, concerts, or other events, while sporting events and religious services are limited to 30% of their capacity. Other remote municipalities with fewer cases will remain under level 1, but they are also likely to face growing pressure to adopt tighter rules due to the fast spread of the virus. Now, it's thus essential to remember throughout the weekend that you may carry on with most of your daily routines, with the level 1.5 measures largely aimed at limiting the number of people at enclosed areas as well as mass gatherings. We also need to keep in mind that the government is monitoring the current situation very keenly to decide whether to raise distancing levels by another notch. So let's all try and be extra careful this weekend.
Right, let's do that. All right, Song-yeon, thank you very much for that coverage. Hope to see you again soon.
Thank you. Hope you have a safe weekend.
Right. We have to turn to Italy right now, where COVID-19 fatalities are hitting levels unseen since April. Just this past Wednesday, officials there recorded over 700 losses of lives. Now, Italy accounts for the second highest death toll in Europe after the UK, with some 47,800 fatalities and more than 1.3 million infections so far, as our Kwon-so mentioned earlier. For more on the situation there, I have Irene Dominioni live on the line. Good to see you again, Irene.
Hi, thank you for having me.
Now, Irene, I hear the resurgence is threatening almost every region in Italy, stretching the healthcare system there to breaking point. Please tell us more.
Yes, the situation is currently very complex and somehow contradictory based on the messages that are coming from national authorities. The rate of infection is rising, but it appears authorities are telling us that the curve is going up, but in a more stable way. So the cases are not becoming as numerous as they were until a few weeks ago. The hospitals are getting filled quickly. There are currently about 33,000 people inside hospitals, but there is an average of about 50% of all hospital beds taken. Yet, while this might not appear such a big and problematic percentage, at the same time, increasingly doctors and nurses and medical staff inside hospitals is getting infected. We currently have about 20,000 medical staff who have contracted the virus over the past weeks. And the mortality rate is also rising, which is another problematic factor and something we should look after.
I see, Irene. Is it also true that medical professionals at the front lines of the battle against the pandemic are not receiving the kind of positive public support that they saw during the first wave?
Yes, we had a very strong rhetoric of the medical staff, doctors and nurses and so on, being some kinds of heroes, which they are, in fact, for being on the first line in fighting this battle against the virus. People have normalized, we could say, their effort. So many of them, we could say, in the public opinion is probably not appreciating them as we should. But nevertheless, they are still on the first line. They're doing their job, and they're calling for people, all common citizens, to be careful, to pay attention to what they
Of course, Irene. Also in Turin, a group of children made headlines recently after setting up their desks outside of their school in protest over its closure. Could you tell us a bit about this?
Sure. Student protests have been multiplying in the state, in the country, over the past few weeks. As a matter of fact, despite the numbers of the epidemic rising, schools were once again, just like in the first wave, sacrificed in the first place because they are now economic activities. They were considered the main activity to have the possibility to close. Yet this was not based on effective data and statistics coming from national authorities. Schools appear safe from the point of view of contagion. So it was really, the government really just decided for these closures in order not to have as many people around going to school, to work, and so on. But at the same time, this means concretely a deprivation of a right for children and new generations. In most other countries, schools were open all along, even during the worst times of the pandemic. And this was not the case for Italy back in spring, and it's not the case today even.
And even against that backdrop, we have healthcare experts there who are calling for tougher containment efforts by the government. Could you tell us a bit about this?
Yes, increasingly scientists and experts are calling for more restrictions. I don't believe, it doesn't appear that a national lockdown it could be a viable solution. The government is extremely worried about the economy. Besides the students, there have been several protests from economic categories, starting from taxi drivers to shop owners and so on. So the government has promised several times that a national lockdown was not going to happen, yet the situation is problematic. So they might have made promises that they can keep.
I see. Irene, a study by Milan's National Cancer Institute shows the new coronavirus was circulating in Italy since September last year, implying that the COVID-19 virus may have spread beyond China's boundaries earlier than previously thought. What is the latest with regard to this study?
Well, you mentioned a very controversial study because when it came out, of course, the news is quite shocking in itself. But experts are pointing to some issues with the publication. First of all, because it is a tumor institute that conducted it. And that means that their specialty is a different one than viruses and epidemics. The second aspect is, of course, that they published this study on their own website. They mentioned, the researchers mentioned that they tried to contact and submit the paper to major scientific journals, but this was rejected because of too big of a volume of research on COVID-19 that is currently being examined. So there are some issues about the methodology because the sample is not representative. So we will have to find out more about this as we go on. Perhaps more research will be found. But indeed, there has been a big discussion about it. And indeed, if it turned out that the virus was in the country already starting from September last year, it would tell us a lot, I would say.
Right, so we'll just have to wait and see then. Right, Irene, before you go, one final question. What is the response in Italy to news of advances on the vaccine front by Pfizer and Moderna?
Well, just like the rest of the world, Italy is waiting for a vaccine. Authorities are already telling us that the arrival of a vaccine, if this will be the case, it will not solve all of our problems immediately. First of all, because it would take time for it to be available to the wider public, to the wider population. Italy so far has selected the Pfizer vaccine for pre-ordering doses. The government has ordered so far about 3.7 million doses, and they are predicting to start distributing it among the most vulnerable categories that are the health workers, of course, and the elderly, and so on. We are hoping that this can happen soon. The government and the European Union at large are speaking about beginning of next year potentially, but again, we are still waiting to see what's going to happen and whether the final tests on these vaccines, which are proving very promising, but we don't have all the certainties we need yet, so we'll have to see.
Right. All right, Irene, as always, thank you for your time and your thoughts.
Thank you for having me. I wish you a good day. Goodbye.
Bye-bye. Right, well, back here in Korea, it's that time of the year again when family and friends gather to make their annual supply of kimchi. Yeah, given the pandemic this year, such social gatherings for this spicy staple have been rendered difficult. So kimchi factories are actively working to ensure supplies. I have our Chon Song-cho at one such factory. Hello, Song-cho.
Good afternoon, Sunny.
Song-cho, what is the atmosphere there like?
Well, I'm at a kimchi factory in Hwaseong, Gyeonggi-do province, just south of Seoul. Yes, we're in the middle of kimjang season or kimchi making season. And on top of that, this coming Sunday is also Kimchi Day. Well, long before the invention of modern refrigeration, fresh produce was hard to come by, and freezing temperatures made the laborious task of kimchi making even more challenging. So families and communities developed a practice of coming together to make enough kimchi to last until the following spring. And Koreans have well kept their tradition until today. And kimjang is arguably one of the most important family events of the day. Well, actually, the South Korean government designated November 22nd as Kimchi Day to promote and to acknowledge the nutritious value of kimchi to Korean people. Well, as you can see, there are all these workers working in this factory, making kimchi one after another. Around 6,000 cabbages of kimchi are being made here every single day. Yes, kimchi is an integral part of Korean people's meals, but it's said to be in high demand, especially these days because, as Sunny mentioned, because of pandemic. Well, people prefer to buy pre-made kimchis like the ones that are being made here, and also it's considered as superfood that's extremely effective at boosting your immune system. So why don't we take a closer look at how kimchi is being made since I'm here. So here are all the cabbages that have been washed and cut up. So you see the worker there cutting up the cabbages. And the cabbages are brined as well with coarse sea salt. So you see the chopping board and chopping up the cabbages into smaller pieces. And then the most important part is making sok, which is really what gives kimchi its flavor. So you see all this beautiful mixture of various ingredients like red chili powder, radish, garlic, onions, fermented shrimp paste, and so on. So all of these ingredients together give that really tangy, sour, but delicious kimchi flavor. And then here is where the seasoning or the sok is applied on each layer of cabbage. And the most important thing is that the sok is evenly distributed, evenly spread on every single layer of the cabbage. And then also to make sure that sok gets to the base of the cabbage and just the right amount, not too little, not too much. And that's the secret recipe for the kimchi making. And here is where all the final product comes. So kimchi is nicely put in the packages and then delivered to families all around the country. So voila. I mean, this is a very extremely simplified version of kimchi making because it can be really laborious and time-consuming, energy-consuming. But at the end of the day, if this is the final result that we come up with, really healthy, delicious kimchi, then I think it's all worth it, right? This has been Jeon Sang-cho reporting live from Hwasong, and back to you, Sunny, in the studio.
All right, Sang-cho, thank you very much for that delicious coverage.
Déjà, j'ai été assez surpris de voir que la salle était pleine. Je m'attendais à ce que 50% de la salle ou 70% de la salle soit ouverte au public. Donc c'était une première bonne surprise de voir les gens masqués. C'est toujours particulier, surtout que je fais la première chanson du spectacle.
In today's studio session, we take another look at the impact of the pandemic on the performing arts industry and on efforts to ensure the livelihoods of people there in this sector, that is, within the boundaries of public safety and health. For more on this, I have Dr. Yu Byung-wook from Suncheon University Hospital. Good to see you again, Dr. Yu. I also have Professor Chi Hae-won from Kyunghee University. Pleasure to have you with us, Professor Chi.
Good afternoon.
Professor Chi, I believe COVID-19 has had a devastating impact on the performing arts industry. Perhaps you can start with more about the plights faced by people in this sector.
I know almost all industries have suffered severely from the COVID-19, but in terms of the live performance industry itself, actually the global pandemic has been devastating artists as well as the theater companies, because the live performance has to be live. I mean, the performers or the actors and the audience members should be in the same place at the same time. So, I mean, this is not impossible in this pandemic. So, as you know, the theater revenues have been operated on and off regarding to the social distancing measures, or many theaters have to keep the safe distance seating, which actually impact the theater revenues of the theater companies. So, I mean, many shows actually were canceled or postponed, and which is actually a lot of actors, performers, or the theater staffs or musicians lost their jobs. So actually, according to the Ministry of Culture, Sports and Tourism, from February to August, almost 9,700 shows were canceled, which actually impact the economic loss of 197 billion won. But it's only until August. So I believe at this point, it is a lot more because of the respread of COVID-19.
Right, because it has been prolonged. Dr. Yu, despite concerns that indoor performance centers could be especially vulnerable to an outbreak due to their enclosed environment, we have yet to record a single case linked to such venues. How do you explain this remarkable reality?
Well, before the answer, I'm still missing the string from the cello in the vibrating my heart. So indeed, I'm really years, I couldn't feel about it. But you know, the people have got fear in the dark. Dark, even we know there are nothing, but we got the fear. Dark means a short of knowledge, but we got the knowledge about COVID-19. We are really appreciated all of the members in the performance art industries and all their audience. They keep the rule how to defense against COVID-19, recording themselves, check themselves their self-diagnosis, and also this is a performing art industry prepared very well to follow in the Korean government regulations. That's why there are not even one cases can confirm as COVID-19. I believe that.
I see. Professor Chi, in accordance to social distance leveling 1.5, of course, performance centers are now required to abide by spacings and seating arrangements. You talked about this earlier as well. Do you see this requirement as ultimately affecting ticket revenues then?
Yes, of course. I mean, the situation is actually tough for everyone, but especially for the producers, But it depends on the style of genre or the scale of the live performance. But in general, to recoup the production budget for the larger scale shows such as musicals or plays, approximately 70% of seats should be filled, which means, unfortunately, there's no way for the producers to reach the break-even point with keeping the social distancing rules. So on the level 1.5 of the social distancing measures, the families or friends can sit next to each other, but must sit separately from other groups. But if the level 2 is implemented, each seat should be separated. So, I mean, there should be empty seat between seats. So the producers have to choose either keeping the show operating in spite of loss or just rescheduling them. Either way will cause the economic damage for the producers anyway.
I see. Doctor, speaking of the COVID-19 situation here in the country, what are your thoughts on the current status? We talked about this earlier on in the show, but we have more than 300 cases today as well. And that is the third straight day.
Well, more than 300 in the domestic. Yesterday, until we got 300 numbers, include from the overseas. But today, we are confirmed the case more than 300 only in the domestics. This is quite a long time we got it. So which means the time to facing the social distance level 2, I'm so sorry I mentioned about it, but many experts in the medicine, we are warned about it since last Fridays. With the government facing on this situation, it's better to move on from 1 to 2, not in 1.5. But anyway, this weekend, probably governments and the CDC agents will be considered about to level up till level 2.
I see. So as a health professional yourself, you are recommending a further hike in social distancing?
I highly recommend since last Friday.
I see. Well, now, for a broader look at the impact of the pandemic on the arts elsewhere, I have Deborah Abramson, a music director who has worked on several Broadway productions. Welcome, Deborah.
Thank you, Sunny. Thank you.
Deborah, I understand Broadway theatres will remain closed until next May. Please do start by sharing with us the challenges faced by those in the industry there.
Yes. Well, there are really two ways of talking about North American theater right now, I think. One is Broadway, and then there's everything else. So let me talk about Broadway for a second. Most of us feel very much in the dark about what's happening, what's going to happen with Broadway. We know that there are several task forces working very hard on it, but most of us don't know what the progress is and what to expect. We do know the challenges are huge, partly because the buildings, the Broadway theaters are so old and they probably need major ventilation upgrades, and partly because Broadway relies so much on tourism. So at the moment, that adds up to a lot of anxiety, a lot of sadness in the Broadway community and larger.
Now, despite the closure, I hear, Deborah, that efforts are being made to engage with the audience on new platforms.
Yes. So there's the online platforms, which I think a lot of people are familiar with. People have been working on that since the very beginning. But apart from Broadway, which has its own set of obstacles to deal with, there are a lot of smaller companies and individuals around the country and in New York that have done small productions using tools like being outdoors and protection screens and face shields and testing in quarantine and drive-in. So there are lots of innovative people out there trying to make something work for now outside of Broadway, just for starters, for some hope.
I see. Deborah, what has been the public response to such efforts?
I think it's been good. I don't know as much as I'd like to know about it. It's been, but there have been limited audiences for it because that's part of what makes it work at the moment. So it isn't, I don't think it's as widely publicized as perhaps it should be at the moment. It's difficult. It's difficult because every industry is suffering so much besides ours.
Right. Professor Chi, I believe you have a question for Deborah?
Yes, I do. Actually, I was wondering, I know there are Broadway League or all the theatrical unions, but so I was just wondering if there's any movement or actions as a group, so toward the New York City or the federal government to get any aid for the artists or the theater workers?
Yes, I'm glad you asked about that. That part has been very frustrating because to a certain extent, especially at the beginning, there was some assistance in place. We have our regular unemployment insurance, and then, which is pretty small for the cost of living in New York City. Many people were also getting an extra $600 per week for a while, but that ended in July. And because our government is so divided right now, and it's so hard to get cooperation amongst them, there has not been an extension. So people are wondering, honestly, how they're going to last until Broadway reopens.
I see. Are there any efforts on the civilian level to help such freelance artists?
I think there are. There are certainly lots of people who are trying to share as much as they can, those who are doing okay to help. That certainly is happening. It's just a matter of how long can we do it, I think.
Right. Dr. Yu, I believe you also have a question for Deborah.
Yes, I have a question, Deborah. Play and the musical still on the show in Korea with a very strict preliminary measure. So that's why we are still enjoying the original French productions of Longterm ballets, It's Been on Others, and also musical Cat is famous, my favorite. It will extended 1 more month. So I believe this is very good for you to be encouraged here in Korea to how to survive. As well, I'd like to give you certain questions. This will be the share our knowledge and experience with you to be the survivor together in your place in Korea too.
Yes, that I would like very much. And we've looked at we've watched, of course, from here, watching what South Korea has been doing to be able to maintain that. And I think in a way it's inspiring. In a way, I think I get envious because our country has so much possibility and so many resources, but really it's because of the way that we conduct things, the way our culture is, the way our behavior is, that we can't have what South Korea has right now. It's very frustrating and very sad to see what we could have been able to do if not for the choices we make. But we still look to your example to say, please let us get to that point.
I see. All right, Deborah, all the best to you, and thank you very much for making the time to join us live with your thoughts.
Thank you so much.
Right, Professor Ji, do you suppose online productions could serve to prop up the ailing arts industry?
Actually, the screening the live performance or virtual stage is not new, but it is true though that it is more considered as a way of reaching out to the audiences since the pandemic. So I think personally, it is a very good opportunity for the theater community to expand the field of the theatrical works into the media platform. And also it's a really good opportunity to exceed the physical limit of live performance. So I mean, this is a really good opportunity for entire theater community, and many producers and many theater shows more interested in the making shows or filming shows and distribute their works out worldwide. But there are still some obstacles to overcome. First of all, I mean, it's kind of new in Korea. I mean, it's not new for entire world, but it's kind of new in Korea. So we don't have enough the professionals to fully understand about the theater as well as media platform. So we need more trained producers and the director. I mean, director for not only for the theater, director for the filming theater. So, and to make more creative theatrical works for online streaming. And we also need specialized streaming platform for live performance or agent to distribute our work worldwide in a long-term basis.
I see. You are at a university right now, Professor. Are there any efforts being made at the university, at the academic level, that is, to help students to overcome such difficulties with online productions?
Yeah, actually, I think it's all about the collaboration. So we need more talk a little more about the trans media and the media and the technology and the theater. So we all talk in the same table. We talk and collaborate to make our more creative works. So to help not only for the theater, to help all the artists and the workers and the media itself as well.
Right. Doctor, you're given the escalating numbers of COVID-19 infections here in Korea. What are your current thoughts on the discount campaign that we currently have in practice to assist both the arts and hospitality industries?
Well, there are two opinions. Because one opinion is governments do not good. Why? Because it can be encouraged people can be consuming and help to the economic situation. But problem is more context. There are more chances of the spreading of the COVID-19. But I have another opinion because government should be supported, kind of enterprise, not only art, tourism, and everything. Because being as like the human beings, so not only the breathing, because we have to eat, enjoy it, and refreshing. So it's like dignity is like to human beings. We have to enjoy it ourselves. So the voucher policies, some of his criticize about it, but with Corona, so we should be looking for another way to live. So voucher policies, yes, now is the number of the patient is increasing. That's why critical by some people are, but we have to look at long term of the policies management. So the vouchers will be showing again when the number of COVID-19 is down. But anyway, we have to live as like the human beings, not only the art performance. We have to looking for the way with the Corona together.
Right, because these performances serve to boost morale as well, public morale, because we're all suffering from pandemic fatigue, so to speak. What are your thoughts on the discount campaign offered by the government for discounts on performances on stage?
I mean, it actually helps it helps, but I think there are a lot of policies and there are funds to help the artists, and the government, the Ministry of Culture, Sports and Tourism, actually they expanded some budget to help out the artists, to assist the artists to take their works online as well. But I think we need more, we need to find a way of long-term survival, actually, for the entire theater community. So I believe this crisis could be an opportunity for the theater community itself. So I think, it's the right time to talk a little bit more about the more fundamental structures of a theater community, for instance, like theatrical unions or more detailed guidelines for the contract. So that could be help out the artists and the producers and for the entire community on a long-term basis. So I hope some of the funds could be used for to develop the industry, the environment of the industry itself.
I see. Doctor, to ensure a continued safe environment within performance centers, of course, what are some of the guidelines that relevant officials there should follow?
Well, from the beginning, I told you, darkness itself we got to fear, but we know there are nothing. We have got the knowledge about COVID-19, how to wear the mask properly, keep the social distancing, even under the indoor performance, keep washing your hands, and enjoy your performance with a little calm your heart, so not like before, the pumping heart. But right after the performance, usually we have this, personal meeting, having tea, having dinners, having another continuous social meeting. But if you want to enjoy this performance for long and safe, you can enjoy the only performance. But right after performance, keep your quarantines back to home safely, and the show will go.
And the show will go on.
Yes.
Right, Professor Ji, maybe a few final words from you for those in the industry to give them a boost in morale as a professor.
I think this is, there are some, I know there are many artists and many theater workers and the audiences themselves as well. It's a really hard time for everyone. So I think this is the right time to think more about the arts itself, why we need arts and what the arts can do for us. And so this is the right time to think about the value of arts and to find a way to do anything to help out the artist and the art itself. So this is the time of the collaboration, I think. So,
it definitely is.
Yes.
All right, Professor Ji, thank you very much for your thoughts. And Dr. Yu, as always, thank you for being with us today. Right, that brings us to the end of this week's coverage of COVID-19. Now, as authorities here have been highlighting, the pattern of the latest outbreak is worrying as it is not confined to one particular source and driven instead by persistent cases within daily settings. So do refrain from any unnecessary venture outdoors this weekend if possible. In the meantime, thank you for watching and see you on Monday.